It's known as Operation Warp Speed, but in recent weeks, the federal program managing the coronavirus vaccine rollout has been anything but. So far, just over 4.5 million Americans have gotten their first of 2 vaccine doses. It's less than a quarter of the 20 million the government had predicted by the end of 2020. And organizational failures across the country have led to confusion, hours-long lines in some areas, and added strain on already exhausted healthcare workers trying to juggle vaccine administration with some hospitals already at or beyond capacity. But while Operation Warp Speed's chief scientific advisor did admit there have been delays, he argued distribution problems largely lie with the states.
We agree that there is a lag. We'll work with the states. We need specific requests for help.
The latest CDC data shows only 4 states have administered at least half the doses they have so far. Here in Massachusetts, we've distributed around 40% of what we have on hand, which is a bit above average. But it means only around 116,000 people have gotten their first shots. Today, Governor Charlie Baker announced the state is expanding the pool of people who can get those vaccines to include first responders starting a week from today. He moved people over the age of 75 up higher in the vaccine priority list, but at this point, there's still a few groups away. And with the state's positivity rate above 9%, up from around 2% in November, Baker once again urged people to take precautions seriously.
Since Thanksgiving, the average age of the people who are being hospitalized has increased dramatically. That has real consequences with respect to life and death,
which we've seen far too much of already. So with more than 20 million COVID cases and 350,000 deaths already recorded across the U.S., and now a new coronavirus variant that's spreading faster than ever, just having prompted another lockdown in the UK, some are pressing to take a closer look at how we're distributing vaccines, with proposals ranging from giving people half doses to delaying the second dose for a period of time to give more people some level of immunity. Joined now by the Dean of Brown University School of Public Health, Dr. Ashish Jha, who recently made the case for second dose delays in a Washington Post op-ed he co-authored. Dr. Jha, Happy New Year. It's good to see you again.
Happy New Year. Thanks for having me back.
What explains just 4 million people vaccinated so far? An uncaring president and an incompetent federal bureaucracy? What explains it?
Yeah, it's a mindset, Jim. It's a mindset that basically begins with the idea that we're going to let the states figure all this stuff out on their own. I think, Monsef Salawi, General Perna, the folks running Operation Warp Speed are good people who are caring. It's hard for me to know what the president's priorities are, but I think the Operation Warp Speed folks really do care about this. The challenge is that the mission that they have been given is get the vaccines to states, not necessarily get vaccines into people's arms. And the problem is states have been managing this pandemic more or less on their own with very little federal help, and they're pretty stretched. And asking them to take on the vaccine rollout is, without the kind of help they need, is a real challenge. Until a week ago, they didn't have enough funding. Congress finally is getting them some money, but just a set of resources that are necessary for the states that the federal government has not provided. That's why we are where we are.
We're roughly 1%, a little over 1% in terms of vaccination. Israel, as I'm sure you know, is somewhere in the 10 to 12% range. I'm afraid you're going to tell me if I ask you, are there lessons to be learned that we're talking apples and oranges? Are we talking apples and oranges, or is there something that they're doing that we could be doing?
Yeah, absolutely. Look, every country is different. So you can always say, well, no country is like the United States. And sure, that's true. But that doesn't mean we can never learn lessons from anybody else. And the lesson from Israel is that it takes focus, it takes a real planning, and it takes really good execution. All things that I think the American government is completely capable of, but it has to prioritize getting these things out. The one other thing I'll say on this, Jim, is it's not like we didn't know vaccines were coming, right? Like literally for about 3 months, we knew that they were going to arrive in early to mid-December. We should have worked out all the kinks, played out all the scenarios, practiced getting these vaccine sites set up and running. And then as soon as the vaccines arrived, we should have started getting them into people's arms.
Well, we will have that new government you're talking about in 16 days. And Joe Biden will have the benefit of, I think it's $9 billion you referenced a second ago from Congress finally. But he's also got a much more contagious variant that I know you have concerns about as well. How fixable is this by Biden, and how fast?
Yeah, so I think a competent and focused federal leadership is going to make a very big difference. I think it's going to take a while. What I'm worried about is unrealistic expectations that somehow on the afternoon of January 20th, that we're going to see this all turn around. Things are going to be getting worse for the next several weeks. That variant that we have talked about, I'm very concerned about what it means for our country in terms of infections and hospitalizations and deaths. It's going to take the Biden administration many, many weeks to really implement a policy that begins to have payoff.
You know, one of the things, Biden's sort of bumper sticker line, I don't mean to disparage it, but it's the memorable thing, 100 million vaccinations in 100 days. The debate that I've heard for the most part is, can he get to that number? My response is, getting to that number is not enough. It seems, I was reading something you wrote, one of the Washington Post pieces, you talked, or maybe it was an interview you did, where I think you said we need roughly 75% immune for this herd immunity that we all learned about recently. You probably learned about it a little while before the rest of us did. But so that's what, 240, 250 million people. If there are 100 million doses, at 2 doses a person, that's 50 million people in 3 months. We're talking a year plus before we reach herd immunity, even under Joe Biden's optimistic timetable. Am I wrong about that?
You're not wrong about that. And I think President-elect Biden, first of all, remember, we're doing a couple 100,000 a day right now. So 1 million is a step up. I like his target. And I think he needs to be more ambitious yet. I think for the reasons you have outlined, we need to be doing probably about 3 million a day. Do I think we can do it? Absolutely, we can do it. We're a big country. We have a lot of capability, a lot of resources. But I would actually, if I were advising President-elect Biden, I'd say you got to go even bigger to get our country back on its feet.
Well, you apparently had a suggestion, or at least opened a discussion in the Washington Post the other day about one way to increase that number dramatically is you proposed a 1 dose for now notion, and you seem to be confident about the protection, but less confident about the duration of the protection. Could you flesh that out a little bit?
Absolutely. So let me be very clear that I definitely believe in 2 doses, but right now the plan is that both doses need to go in within 28 days. And because of that, what we're doing is we're keeping more than half the doses we have produced in a freezer and not giving it to states and saying, we'll send it to you when you're ready for the second dose. My approach, not mine alone, others have also argued this, is let's take all the doses we have right now and get them out, get them into people's arms, let the immunity start working, let's start protecting people. And then as new doses come off the production line, vaccinate people on round 2. That might mean some people might get it in 4 weeks, but other people, it may have to wait 6 weeks or 8 weeks. There is plenty of good scientific reason to think that is going to be fine. People who are very much purists say, hey, well, that's not what we studied in the clinical trials. That's true. But in the clinical trials data, you can see pretty effective benefits, 85 to 90% efficacy after 1 dose of the Moderna vaccine out to 28 days. There's no reason to believe that somehow that'll plummet by day 35 or 42. So I believe in 2 doses, but I just think we should be less stringent. The upside will be that we'll be able to vaccinate twice as many people and protect twice as many people, and I think save an enormous number of lives.
Well, you mentioned, I played sound from Moncef Slaoui a little while ago, Chief Scientific Advisor, Operation Warp Speed. He was on a Sunday talk show and said that he didn't believe the data was as convincing as you appear to believe, and he proposed a variation on a theme. Here he is.
We know that for the Moderna vaccine, giving half the dose to people between the age of 18 and 55, 2 doses, half the dose, we know it induces identical immune response to the 100 microgram dose. And therefore, we are in discussion with Moderna and with the FDA. Of course, ultimately, it will be an FDA decision to accelerate injecting half the volume.
You know what worries me about all this, even if Slaoui and you, Doctor, are right, is, and I know you're concerned about this too, we have a vaccine-hesitant nation. I mean, we've read these appalling numbers. You and I discussed a couple of weeks ago healthcare workers, whether they should be mandated to get vaccines. You've read these stories out of Ohio, all over the country, where majorities of healthcare workers are just saying, no, they're not going to do it. This feeds, this late in the process, it seems to me, the notion of a single dose or a half dose, even if it is a brilliant interim solution to the problem, doesn't it feed the doubts of even people of good faith? Why weren't these issues raised by leaders on this issue prior to vaccine manufacturing? You know what I mean? I do. I'm concerned about it now. How do you deal with it?
I am too. I hear you, and I think that's an important point. We raised that in the op-ed in the Washington Post, that if this somehow causes people to be... I guess the way I have thought about this, Jim, is throughout this entire pandemic, there has been this conversation that, that public health and science is something that isn't static, and we work through it. The science on masks changed, and we changed our recommendations. And so people have said, well, isn't this just going to cause more whiplash? And my approach has been throughout the whole pandemic is speak openly and honestly and plainly with the American people. Tell them what you know. And if you think that we should change plans, tell people why you're thinking about it and what the upsides are and downsides are. And my sense is most people are pretty reasonable, and they will go along with it if they think that people are using the best science possible and doing it credibly. The downside of not changing our plan at all, sticking with the 2 doses, 28 days apart, is we are looking at probably 120, 140,000 more deaths before the end of February. Yeah. That's kind of what we're looking at. And those numbers will continue into March, that the most high-risk people will not get vaccinated before March. I find that unacceptable. And so what I'm saying is, I'm not suggesting that making changes has no cost. I'm saying, but the status quo has a very, very high cost. Yeah. My take is we can educate most people, help them understand that what is being proposed is reasonable, it's grounded in science, and use the sort of openness and transparency to try to convince and bring people along.
Last thing, Doctor, if I can, is you mentioned deaths. I believe my numbers are right. Somewhere in the neighborhood of 80% of the deaths have been people over 65 years old. You're nodding, so I assume I got that right. Pulling from the file of even a broken clock is right twice a day, people like Ron DeSantis have decided to move to the top of the list older people, above first people who are providing health care directly on. If that's where the deaths are, why isn't that the right solution? Quickly, if you can.
I've come to believe it probably is the right solution.
Really?
I think a lot of complex policymaking on who goes first, who goes second is going to probably slow us down and be open for gaming. So I am increasingly coming to the opinion that we got to get, especially our elderly, vaccinated immediately. People over 75, then over 65, then over 55. Then after that, we have many more options. But we've got to move towards an age-based approach because that's probably the most efficient, and it certainly will save the most number of lives. And, Jim, I actually think it's the most equitable because if we make the system overly complex, let me tell you, the people who will game it, they're not the poor. They're not the people of color. They're the well-connected, wealthy people who will figure out how to game it. And I'm worried about that as much as I am anything else.
Dr. Jha, as always, thanks for your work and thanks for your time, and Happy New Year, and hope to see you again soon. Be well.
Happy New Year. Thank you.
Thank you.